Welcome to The Global Dentist, the show that opens doors for international dentists looking to transition to North America. This is Sadaf, and I'm here with my co host Rata.
Join us as we explore unique challenges, inspiring stories, and practical advice from dentists who have successfully navigated their journey from practicing overseas to establishing their careers in United States and Canada. Today we have a special guest, and I'm so happy to have her. We have attended to the same general dentistry school in Iran. Today we are going to have Dr. Negar Mehdi, as our guest that she got accepted to a program in Canada to get her license. I'm not going to share many details about her because I'm so excited to hear her story. Could you please share a little more about yourself?
Well, sure. First of all, hello everyone. I'm so glad to be here today, and I hope I can share some information that would be practical and useful for everybody who are looking to the transition to North America. Well, as you said, my name is Nagar, and today that I'm talking with you, I am 26 years old. This is one information that actually is important here. It's going to be important. Um, and well, my first encounter with Canada, coming to Canada, was through my family. My family actually applied to become residents of Canada under the category of skilled worker back in days. So I came here even before I go to dental school the first time. But unfortunately or fortunately, we couldn't settle at that time. So I went back. I finished my high school back in Iran, and suddenly I was accepted in dental school. So at that time, I was still hesitant. I even applied to a bachelor's program here in life sciences, and I secured an admission for in U of D. But after a lot of consideration, consulting with different people, we decided it's best for me to obtain the DDS degree in Iran and then move to Canada and do the equivalency process here. Especially at that time, it was almost about a year kind of program that you could do or like do the exams to become licensed here. But after 6 years of dental school, many things has changed. A lot in Iran, a lot in Canada. A process that was taking about 8 months to 1 year, nowadays taking usually around 3 to 4 years. So I was here finding myself, okay, what do I do now? I have to go through another process that approximately takes somewhere around 3 years. But fortunately, I believe right now I feel like I have finished the equivalency part of the process, although I'm going to attend the school beginning September as a second year dental student again, and I have this 3 year ahead of me. But still, I feel like, okay, I'm done with the equivalency part, and it is assured that I'm going to come out of this school with a DDS degree, which is accredited, so I can work in North America and some other countries as well. Um, and this is a little bit about me. So we'll walk through the rest of the process together. The one fun fact is that like it's really explaining the equivalency process in Canada is really hard. One of the reasons is that we have multiple routes and we have multiple choices to like options to choose from. In Canada, you can one of two of the most popular routes that you can take is what first of all is what we call direct licensing. It's not that direct, but it's known as direct licensing. It is a process that you take three different exams through the National Dental Board Examining of Canada. Here, people know it as NDEB in short. And after these three exams, you do the dental board, the OSCE board, which every dentist, every dental student here does in Canada at the end of their studies, and you become a licensed dentist. So if you choose this route, which is the most popular one, I think based on their statistics, around 600 to 700 dentists every year go through this route and become licensed dentists here in Canada. So like this is the one that everybody usually does NDEB process at the beginning. Um, in NDB, you take three exams. The first one is Assessment of Fundamental Knowledge, in short, AFK. It's a written exam, multiple choice. It covers most of the subjects that we have studied back in school in the DDS program. And this exam actually takes place twice a year. So basically, you're competing to get a seat even for this exam. And this is the hardship with the process in Canada. Seats are limited. You have to compete for that. If you successfully pass this exam, you move to the next one, which is also again twice a year. So you have to wait another 6 months to get the next seat, hopefully to get, which is assessment of a situational judgment, what they call ACJ. And it's a radiographic and case interpretation exam. After this is one of the actually like nowadays it's the easier one because as the highest passing rate and like the process is really more smooth in this part of the way. But after this, now it's the biggest challenge here you have what they call nowadays as NDEC. It used to be assessment of clinical skills, but it's nowadays it's like a two-part exam. It's one day of assessment of clinical skills that you have to prepare some actual work in 8 hours time, and another day you will be assessed what they call assessment of situational judgment. They basically send you to the rooms with actors there and they will present some scenarios to you. You have to play along with them and actually kind of manage a patient-based environment. This exam, it has multiple attempts. It used to be only 3 attempts. As for AFK and ACJ, it's only 3 attempts. If you fail in those three, you cannot continue with NDEB route anymore. But for skills exam, you have multiple attempts. But you have to finish the whole pathway from the beginning of the AFK exam till the end of NDEC exam in 5 years period. So if you don't do it in 5 years, you have to go back to the AFK exam and do the whole thing over again. There are people who actually happen to be able to have to go back again and do it again. But the good part is now that you can take skills, as I mentioned, multiple times throughout the year. Usually, you get like 3 to 4 time cycles for administering for the exam because it opens every 3 months and it opens for another like 3 4 months. So you probably gonna get spots at best case 3 times a year. If you fail once, you can do twice more at the same year. But bad part of about this exam is that people actually do fail. Like I want to be political here and say no, you can do it. Definitely, like let's go get it. But skills exam doesn't work like this. The passing rate used to be somewhere around 30%, which well, it means 70% will fail. So you have higher chance to fail than pass. And now that it's like 2 parts, if you fail in one part, you have to do it again and like do the next part for the next cycle, another 6 months of waiting or like at the best like 4 months of waiting. So many people will actually be stuck in this part of the process. And for me, this was the one that I never thought about even going near to it because I know the stress that people go through for these last step. There, it's no joke. And honestly, I have seen it very up close because my partner is taking this exam now. He chose the other route and I chose this route. So now I see that how much stress people go under because of this step and a lot of financial burden as well because it's really pricey. Like you don't want to hear. It's so pricey. Yeah. So if I can any share any more information, like feel free to ask because I don't know like how much details I have to share here. Yeah, perhaps. First of all, about AFK scoring, NDAP stopped giving the scores to schools. Almost, it's been 3 years now. I think 3 to 2 years. So nowadays, AFK is just a pass or fail exam. Even for my cycle, it was a pass or fail exam. And one of the reasons that actually schools kind of had this struggles with NDEB and they said, okay, we're not going to take your exam anymore was because of the reason that they don't give scores anymore. For ADAT as well, like not, that's why they switched to ADAT. So now we have scoring in ADAT. Um, my experience, I applied to almost every school in Canada last year. I couldn't apply to U of T and University of McGill because of their deadlines. Um, which for them I had to take my ADAT in July, but because I took AFK and like I had this exam timeline ahead of me, I couldn't take the exam before July 2nd. So I did it in August. So I couldn't apply to McGill and U of T. For different schools here, they have different criteria. the ADAT score matters a lot to these two schools, McGill and U of T, which I didn't apply. These schools are really like they really care about your academic credentials, your GPA score, and your ADAT score. So based on what we observed, people who had ADAT score above 600 were on the competitive edge, like about 580, I would say you would be competitive. There were people with 530, 550 who got accepted, and people with 640 that got rejected. But the majority, if you want to like put a baseline for it, it would be like score somewhere above 580. If you go above 600, you have good chances. If you are Iranian, please score above 610, 620, because Iranians are like on the competitive end of the spectrum. They usually score really good. So if you score somewhere above 600, you have the chances to get into U of T. For McGill, it's even harder. Like they say, go above 630. And McGill only accepts 3 students. They give preference to the people who live in Montreal, residents of Montreal, for 2 years. So basically, there will be left like 2 seats, one seat or 2 seats. For me, honestly, I'm not gonna apply to McGill because like I'm not gonna compete for 2 seats. But McGill is more competitive on ADAT score. Other schools last year which accepted ADAT was University of Saskatchewan. University of Saskatchewan is the opposite of U of T. They don't care much about your academic credential. There were people with ADAT 440 who got invitation and like at the bench test and everything, and there were rejects of 640. So like the spectrum of the scores that they invited and they accepted, like it was somewhere around 500 to 600. So whatever in that scale, you can have chance for University of Saskatchewan because it's in a school that has bench tests as well, and they really care about the bench tests. Schools that have bench tests, I would say they put like 70% of their focus only on their bench tests. So your score there doesn't matter much. And last year, these were the no, actually there were Manitoba as well last year with ADAT. I applied to Manitoba. I got an invitation from Manitoba. My ADAT score is 620. So like I'm in the competitive edge among different ethnicities. In Iranians, I'm like a little bit hesitant for U of T, but if I do good in my interview, and probably my resume is good, with 620 you can get in most of the schools if they care about your ADAT score. So I got invitation to Manitoba. Manitoba has a bench test, which has one of the hardest bench tests in Canada. They say it's exactly like NDEC exam. Like you do all the procedures you do for NDEC in Manitoba. But after I got invitation, I got accepted in Western. So I said, sorry, I'm not gonna come. But I attended the Saskatchewan exam bench test. Even then I was accepted in Western, so I didn't practice for that. I just went there to like see how it goes. It was the only in-person interview, so I really wanted to have that experience for later, and I've already paid for that. So I said, why not? I have the ticket, I have the place. Let's go do the exam. I went there. I ended up in waitlist in University of Saskatchewan, as I mentioned, ADAT 620. My interview was good. I can say like after doing all the school interviews, I have good skills with interview. And my work there was not really good. It was like I would say the worst work I could have ever done in the bench test. Because I was really happy that I'm going to Western. I'm not gonna come to Saskatchewan. But I ended up in waitlist, and they waitlist has like 10 people usually. So it's I would say like interview and ADAT helped me ending up in the waitlist. But again, ADAT score doesn't matter that much to some of the schools. If you care about your ADAT score, it must be because of U of T and McGill in Canada. I'm not going to go more into the detail of this equivalency and DEB process because, like as I mentioned, you have different choices here. One choice is to go through this. This is the most popular, but this was not my choice, and I actually recommend most people, to consider the other routes as well. There is something like that we call as going back to school or school equivalency process here that you have the option to go back to school, do one exam, and then apply to universities here for a qualifying degree. Um, it takes around 2 to 3 years. the degree itself. We say 2 to 3 because only one school has a 2-year program, but the rest are 3. So basically, let's consider a 3-year program. You apply to the equivalency process, like the courses in the school. Cut this part. And you apply for the school. You get the interview. Some of them have the bench tests, like different processes for each school. In Canada, there is only 6 schools available for international dentists that you can apply to. English speaker applicants, actually. There are 2 more for French speakers, but you have to have a C1 degree in French, which is actually really hard. So I don't know anybody who has ever applied to those 2 schools. But for English speakers, you have 6 schools. University of British Columbia, unfortunately, they don't accept any internationally trained dentists. So you have to eliminate that, and you're left with the other 6. For applying to the university route, before this year, some schools were accepting AFK exam as their prerequisite, the AFK exam from the NDEB route. But fortunately, as of this year, all of the schools changed their prerequisite exam to ADAT exam. The year I applied, half were on AFK, half was ADAT. So I had to take both of the exams. I took AFK and then I spent some time studying for ADAT so that I'll be able to apply to all of the schools. So I increase my chances of acceptance. But good news, they are done with AFK, they are done with NDB. So if there is a person who chooses to, I just want to go to university, this is what I want, I don't think about direct licensing, then it's better for them because they can only do the ADAT exam. And for me, actually, I was a person who knew I would go to university. I would never even touch the NDEB exam, but I had to do it both ways. ADAT exam is an American exam. It's advanced DAT, which covers some basic sciences, biostatistics, and a lot of clinical subjects. I would say it's a very vast exam. But for people who are in Canada and who are doing the equivalency process in Canada, who know AFK and go through with it, I would say ADAT is a little bit easier than AFK. More subjects will be covered, but easier questions. So if you take ADAT, which is an exam that happens multiple times during the year, I think it's from March to August each year, May to August, if I'm not mistaken. I don't have it exactly in my mind now, but it's like a 6-month period there. So you can book your exam almost 3 times to 4 times a week. There are different time slots. It's actually way better than AFK exam and the NDB process here that you have to fight for your seat. You have 2 attempts here each year, and this is actually really good. But the thing about ADAT is that they give you a score, and based on this score, schools will rank you. So the higher score will have the higher chance of getting in. This is something that will be implemented in Canadian schools, in all of them from next year in 3. So my cycle, we had still AFK, we had different paths. But from next year, you have to focus more on your ADAT score to get into school in Canada. And this is the second popular route besides NDB to go back to school. In Canada, you have still 2 more routes left that I'm just going to brief on them because they are not so common and not many people actually become dentists through those routes. One of them is applying directly to a specialty program, a master's program in schools here. Not all of the schools will accept international dentists. Not all of the specialty programs will accept international dentists. So you have to search for those specific schools, those specific programs that will have seats available for international dentists. Maybe each year I have heard 5-6 Iranian dentists who could get into these programs at best. But if you go through with it, at the end you can take the Royal College board exam and you become a licensed specialist in Canada. They say that, well, you can practice only as a specialist if you go through with this route. But honestly, I don't know if in our field it has any meaning. If I open a tooth and I do an endo on it, so basically I'm doing everything. If I'm doing a prosto, what does it mean? A prosthodontist can do everything. So nobody actually defines the boundaries of how much work you can do, but they say only your specialty field. And also in US, you can basically work in only, I think, 5 states. It's different from time to time because of the federal rules. Maybe it's 6 states sometimes. If the president changes, it might become 2 states. Nobody knows, but your options will be a little bit limited if you consider working in the US after that as well. Also, there is one more route for already the specialists back home, what they call here as gap bridging programs. Um, Again, not all the schools offer this program, and not all programs on all the specialties have such program. First of all, your specialty should exist in Canada. For example, restorative doesn't exist here. So if you're a restorative dentist, I'm sorry, you can't do this. But if your specialty exists, if that school accepts gap students for that specific specialty, then you can apply for a 1 year program, which actually validates your specialty, and you can practice as a specialist dentist, and you can become a member of faculty after that as well here in Canada. I know only one person actually who went through this route. So, like as I mentioned, these are like very, very narrow windows. Maybe like maximum 10 people each year become licensed like this. But the two most common are that NDEB and the school application program.
Speaking of like both bench tests and interviews, I want to know more about your interview process because you said that you have a couple of like experiences, and also about bench tests. I wanted to know if you got any like take courses for bench tests, or it was just you that you practice, or maybe YouTube videos.
Mhm. Yeah, sure. Well, let's first say which schools have bench tests and which don't. So, like the good thing about Canada, you only have 60 schools, so I can like open up the details about all of them. In Canada, University of Western, University of Manitoba, and University of Saskatchewan, they have bench tests. 3 different bench tests in University of Western, which I'm gonna attend. Your bench test is totally different from the other 2 schools and the DB process because it has class 3, class 5, and class 1 restorations, preparations and restorations, which like very like maybe first year of dental school kind of projects, and they sit you in second year, so that makes sense. Their bench test is more of the assessment of your professionalism, how much potential you have to become a good dentist. That's when people ask me the question like, what do you feel was the criteria? I would say in Western, it's not that how good of a dentist you are right now. It's about how much potential you have for training. And if they feel like you're a good artist, you can be trained, you're flexible enough to be trained, you have better chances with Western school. But in Saskatchewan, it's actually the opposite. They want a good dentist because they sit you in this third year of the program directly in touch with patients. Saskatchewan has limitation in number of dentists, so they want somebody who actually be there, take care of their patients, be actually a good dentist, a fast dentist. So the criteria are really different from school to school. Even in Manitoba, they usually look for people with more experience. Um, for these schools, like I personally, I'm on the side of taking coaching because based on the statistics, people who got in were the people who got coaching and some preparation for these schools. Um, it's not like I would say like if you practice at home, get a home unit, rent something, start practicing yourself, you can't make it. But for sure, your chances will be less than the person who is going through the intensive coaching program, like with schedule, doing mocks. For me, I gave my all for Western because I knew this is a school I want to attend. It was my first choice, so I did everything that I could. I took coaching, the demonstrations. I did practice every day. The last month, I practiced from 6 a.m. to 10 p.m. without much of rest, and like I did multiple mocks a day just for 3 preparations and 3 restorations so that I make sure I guarantee that spot for myself in Western school. And at the end of the day, from all of us who got in, 90% had the coaching. And 10%, yeah, they were really good. They had great hand skills themselves, or maybe they don't sometimes say that they get coaching. Like, honestly, people here, they are competing. because it's Canada and competition exists. So I would recommend, if somebody wants to secure that spot for themselves, give your best, get the coaching for that. And even for interview, I took all the interview courses that were available on the market because I wanted to do my best. And I'm not a person who says, okay, I'll try myself. It's okay. I'll watch YouTube videos. I wanted somebody to guide me, because when you get coaching and when you get courses, part of the planning, part of the burden of the planning, the energy that you spend on figuring out the material, going through question, that will be eliminated. You can focus only on your content, on your expression, on your practice. And this is a good part about coaching for me. I'm a person who wants the guidance, the planning, and I don't want to spend time there. So I took coaching from every institution that were offering something in Canada. And at the end of the day, I think it helped me a lot with my interview skills, because every person has their own perspective, their vision, their answers. And when I combined all of them together, I came up with my own formula, what actually suits me the best. And I think I actually did really good with interview training. Um, so I would recommend coaching, but I don't say that you can't do without it. Of course you can do. Like, it's a basic exam. Like, everybody knows the material, everybody knows the question that will be asked. If you're good with planning for yourself, if you don't need the confidence from somebody else, you can go ahead and do it yourself for sure.
Yeah, that's very interesting because so many people have very, very different perspectives on that. Like, some people say, well, it's not good to have coaching because then you'll get influenced by other people's ideas and then it's not you who's taking the interview. While some people like advise it a lot. I guess it depends on you and your skills as well to, like, some people take advice really well and can personalize the advice that they get to themselves to get the best result out of that, I guess. So, what would you say was the biggest challenge for you during this process so far? And Negar, you mentioned about the GAP program for like people who are already specialists back in their home country. Do you know how many schools offer that, and are is that for all the specialty programs or specific specialty programs that can do that?
Well, hardest part for me was that, like, I'm in this transition period from ADAT scores to AFK. So for me, honestly, going through both ways was really challenging. Because when you take the first exam in NDB route, you'll feel like, okay, why not taking the second and the third, and I become a licensed dentist. So I even actually went with that. I took the second exam as well. So you face this dilemma of, okay, now I did the first one, now what? And then the ADAT comes up, and then many people like me, they'll be tempted, okay, we don't have chances in Canada, it's really stressful, it's really competitive, let's take IMBD as well. And they do it like me. So one of the first challenges I had, like the most challenging thing about part about the whole process for me, was to being focused only on one route. Even if I knew that I want to go to school, because I'm a person who thinks about a specialty program, who wants to stay in school till my 40s, I had to go to school here. So it was the only way. But still, I took all these different exams and I had all these options. Choosing and sticking to one was really hard. But regarding the school process itself, bench test is something that, first of all, it scares you a lot, because this, like, as I mentioned, there are, like, especially for Western, was like very simple projects but a lot of competition. So you doubt yourself every day, like, I'm doing a class one and everybody else there are doing a class one, so everybody does good. How can I get in? How can I win this competition? And it's so stressful. I would say, like, if you get distracted by the competition, you might lose it. And also the interview process, for me, it was my first interview, like the first time in my life going through interview, because in Iran we don't do interview much. And when coming to Canada, first exams are just written. You're not challenging yourself, sitting in front of somebody, talking with them. So it was really challenging to become ready to just sit there and present myself as who I am. And I can say I aged 10 years. in the 2 week I prepared for one interview, the first interview I had. Like honestly speaking, I was finding white hairs in my head every day, and I couldn't sleep for 2 days. And I would say it was really, really, really stressful. Canadian environment, unfortunately, is so competitive. You always wake up in the morning, count how many people will get into school and how many are doing the exam with you. You doubt yourself. You give up for sure. You think, okay, let's do direct licensing. But at the end of the day, you have to choose your path, stick to it. Of course, it's not bad to have all the options open. And I still recommend it. Like, even if you're like me, you choose to go to university, at least do the first exam. Keep it for yourself there, that as like a safety button. Like, it is there. If I don't get anything after 2, 3 attempts, I can at least do the direct licensing path. But focusing is challenging, the competition is challenging, but I want this time I want to say something very happy. Like, I was discouraging people, I feel like, by saying it's competitive, it's hard in Canada. But the good part is, through this university entrance program, there are 60 schools, there are multiple spots. Not many people will apply. And after going through this, you will see, oh, at the end of the day, most of the people got at least one spot. So if you really want it, and if you want to invest on it, practice for it, be ready for it, you can get it. I would say it has actually a very high success percentage here for the universities route. Honestly, I don't know the specifics of this path, but I know that not all the schools offer this program. For example, Alberta for orthodontics, don't offer anymore. They might reestablish the program again, and for Perio they do. Like as I mentioned, each program, each is even each within the same school. Like Alberta school, for one program they have it, for the other one they don't have it. So, and for different years it's also different. They might establish a program today for next year for example orthodontics somewhere, and they might eliminate the program for endodontics somewhere else. So for each year that you're going to apply, first of all, you have to search for that specific timeline, for that specific school, for that specific specialty. The School of British UBC and also University of Toronto are most of the programs there have this gap bridging program. They usually used to have it, but still, if you want to apply, you have to check with the school. And for gap programs, you usually don't get very concise information on the website. I understand that many people go there and search. You don't find much. You have to actually email the faculty, email the head of the department, ask them, explain to them your situation, and then they will give you the advice. And also, you have to find people who actually went through this path in that specific school and that specific program, so that you can get the guidance. It's actually a very vague part of this process, and that is why not many people get the spots for gap program. The only way to know for you as a specialist is to email the dean of the faculty and the director of the program.
Yeah, it was awesome. I learned so much because a lot of people also ask me about the Canadian path. And even though I started the Canadian path, like I moved to Canada before moving to US and I wanted to take the AFK, but even before taking it, I moved to the US. But I still like so many things have changed since then that I have no idea how things work right now. But I have one more question that's a slightly in a different route. So you explained that your parents moved to Canada through the skilled worker route. In the last episode, we had Shayan who had moved to Canada through express entry route. And what other immigration paths do you know of for dentists who would like to move to Canada as their second home and want to establish their life there? Yeah. And you mentioned about improving your CV, especially if you are a general dentist and later on you want to apply for specialty. But for people who want to take the route that you took and want to start university in Canada and become licensed general dentists, how can they improve their CV and how did you improve yours? Yeah, I think that's a really really good advice to make things personal because I've seen a lot of people that when they ask them, tell us about yourself, they just give a summary of their CV, and that doesn't tell anything about you because they already have your CV. And even in the US, it's so important for schools to know that you are teachable and you are there to learn. So, do you think that for dentists who have more experience back in their home country, like they worked 10, 15 years in their home country and now they're moving to Canada, can that be to their disadvantage that they have more experience? Can that come across as, well, you already know everything, what can we teach you?
Okay. Yeah, I got your point. I actually covered it, like the advantages and disadvantages of both paths. Um, well, you can. Politically speaking, you can. You can do whatever here in Canada, in US. But the thing is, okay, what CV are you building for yourself? What are you going to present, and how are you going to compete in that game? You can apply as a for a residency program here in Canada and also in the US if you go through the direct licensing path. But your chances will be less than a person who actually obtain a North American degree. But at the same time, like there are schools and there are programs who prefer people who have 2 years of work experience. And some schools actually have this as their requirements. Like even if I go through this DDS program to apply, for example, for orthodontics in Western school, I have to have 2 years of work experience. So basically, I have to go out, work, and come back again. And a person who did the direct licensing work for 4 years, they also have a chance there to get into that specific program. Uh, but statistically speaking, yes, if you go through the DDS program in the US or in Canada and then apply for a master, you have more chances of acceptance. But it's not like you can't. Definitely you can, and there are people who did it and succeeded actually in that path as well. Sure. Um, regarding the CV, like I know in the US, your extracurricular activities, your SOP, whatever articles that you had, is really important for the schools. I don't say here it doesn't mean anything or it doesn't matter at all, but the role of your CV is a little bit way less than the bench test and your interview. Basically, I feel like there are schools that they don't even read your CV. And actually, there are schools that they don't even ask you for CV. The University of Toronto doesn't want to see your CV. University of Alberta also they say don't send us CV. It's written in the on the website. Don't send us. So they basically just see your scores. And in Canada, they are schools are more like that. As an Iranian dentist, I would say it's more like Iran. They just care about like how much is your GPA, how much is your ADAT score, like they just read that paper and they ask you for an interview. And in an interview, if they like you, they'll accept you. The only school that I sent CV to was University of Saskatchewan and Dalhousie this year. Dalhousie actually cares about the people who have a background of working back home, maybe studied a master's before. Because I thought most people with that background got invitation and got into school at the end of the day, and they do care about this extracurricular activity a little bit. Um, but other schools they don't care much, honestly. For me, if I want to explain my CV, like I have 3 articles. Two of them are ISIL articles which are published. Besides that, I have zero work experience in Iran, and this is the part that we go back to my age. I'm the youngest applicant in the cycles in Canada who got into school here. Everybody else are like at least 2 3 years older than me. So zero work experience. But I put like a little bit of volunteer work, maybe like working for outreach program once or twice, and a little bit of observation work here in Canada, like in a office, in dentist office in Toronto. I observed the dentist for some days. Um, these are the things that are in my CV as work experience, that observation, that volunteer work in Iran, and a little bit of this articles that I had. uh, but besides that, I would say my CV is not something very shining and bright. The thing is, how do you actually express yourself in the interview? How do you present yourself and your CV in your interview? For somebody, having zero experience might look like a bad thing. But what matters is that when I go to interview, I say, well, you see, I'm a flexible person. I don't need to relearn. You just can teach me. I will accept. I will say yes to whatever you say. So it matters how you actually present your CV. The only school that I observed they might care about your CV a little bit are Dalhousie and maybe Saskatchewan because they want a little bit like experienced dentists who the people who can actually help that provinces to overcome their shortage of dentists. But other schools, some of them even don't want your CV. So in Canada, the story about CV is totally different from the US. I know that for US, you have to build up on it. But in Canada, just focus on the interview, I would say, because interview matters to most of the schools. And bench test also, of course, for the schools who have bench tests, yeah, definitely. For sure. Well, for somebody who's taking the route, taking this path this year, first of all, I believe you should start focusing on your ADAT score because all of the schools are now adapting ADAT. So University of Alberta will be a very competitive school for you because after University of Toronto and McGill, Alberta is one of the schools who accepts almost around like 20 applicants each year. So you will be competing probably with your ADAT score. The first thing to focus on is the ADAT. After that, for the universities which have bench tests, they usually put more than 70% of the weightage on the bench test. So even if you don't take coaching, start practicing for the exam. Get this mini units at home units and start working for it. Maybe watch YouTube videos and practice at least 4 hours a day, like 3 months before exam. You have to have this amount of practice. This is a list amount that I would say you have to put for the bench test because that's no joke. It's really competitive. Um, and at the end of the day, each school you go to, if it's Western, if you pass the bench test, you'll go to interview. If it's Alberta, it has 3 days of interview. And if it's Saskatchewan, again, you'll get an in-person interview. U of T only has interview. At the end of the day, you have interview. And the interview is something that I believe can set you apart. Um, for interview preparation, I'm not saying necessarily take coaching. Some people will feel more comfortable practicing by themselves. But if you take coaching, if you practice by yourself, first of all, start researching the school. Know everything about that specific school, everything that they want to hear. Some schools, like Western, which I got in, and also Alberta, which I got in. These two schools, like I knew Western cares a lot about community programs. So you have to learn these about this school. You have to talk to the students who are there, who are actually in the faculty. If you know this school cares about community program, when they ask you something, you have to talk about it. If regarding Alberta, I know they care about research. So if they ask some question about me regarding like my experience, whatever I have in my CV, I would say, okay, I like research. I did research. So first of all, research the school. Know everything about it. Know everything that they want to hear there. And at the end of the day, practice a lot. Practice in front of the mirror. Practice with your friends. Be comfortable sitting there because the first interview, I would say, is one of the most stressful moments of everyone's life. There are people who are there, and you know that they are going to judge you. We in the daily life we say no, we're not going to judge you based on what you say, but interview is a setting that everybody knows that you're being judged based on whatever you say. So be ready for that. Be ready for controlling that stress. Having a stress is totally normal. If you have a stress in that situation, they know you are passionate about the program. They know you want to get in. That is why you have a stress. But how you control it, it makes a difference because a person who can't control the stress, how you want to become a dentist then? So be okay with stress management, with controlling yourself. And one specific tip that I want to give, don't talk about your academic credentials and your professional life a lot in interview. They are seeing at least like 20 people in that interview setting. And all these 20 people are accomplished dentists for sure. They have worked a lot. They had a lot of patients. They have a lot of academic achievements. So how are you different from those 20 people? You have to say the things that make them remember you. Personal things. You have to somehow touch their heart. They have to like your personality. and you have to stand out there. Like, I just give you a very simple example. They usually ask about your life. Some panel questions are generally like about your personality, your goals, your visions about life. For example, they ask me like, what are your goals in 5 years? If I go ahead and say I want to stay in school, I want to do research, I want to do blah blah, I said these things, but at the end of the day, I knew they're not going to remember me because of that. I said, well, I want to adopt a dog, and I'm pretty sure they remembered the person who wanted to adopt a dog. So you have to say these kind of things, these personal notes and touches to your interview so that they remember you as that person. And you have to be a very pleasant personality because they want a good colleague and a good student, first of all. In Canada, you shouldn't be a person who is like filled with experience and I'm a really good dentist, I want to join your faculty. No. I'm going to be a really, really good student and open to learn everything. So this is what I would say, let's suggest to work on for your interview. Be a good learner, be a flexible person, a little bit of positive, too much positive personality, a nice person. These things will make you stand out. But make your portfolio, even if you know you have shortcomings, such as my work experience that was very limited, make them to your strengths. Use them in your benefit. And it is possible for everybody with any experience. Well, there are some myths here that school prefer young people. But I would say this is totally wrong. Um, in Canada, we have a very small pool of candidates each year. So basically, I know almost everybody who applied to school in Canada this year. And I know the results now. The results are out. All of the schools give their answers. So we know who got in, which friend is in which school. And at the end of the day, the demographic of people who got in are ranging from very young, like me, to like more than 40 years of age. And they are distributed actually equally. It's not like no more of the younger people got in and not much of people with a lot of experience. It's not like that. It's totally equal. Even they say there are some preferences regarding diversity, different ethnicities have better chances. This is also totally wrong. Like, I was told many times that because I'm an Iranian, even if I do really bad in a bench test, I have chances to get into, for example, Saskatchewan because I'm the only Iranian in the exam. It is not like that. Everybody who got into Saskatchewan were actually from India because they did better with their bench test, and I did really bad with my bench test. So these are myths that your demographic, your ethnicity, your age, your experience has anything to do with the result. If you have a lot of experience, you can use it for your benefit. You can highlight it in a way that, well, I have this experience, but I would be really glad to gain more experiences in another field, actually, and learn more about the general dentistry here again. Because unfortunately, I was focused on that specific part, so I missed a lot in dentistry. That is why I want to become a dentist student again. And that is why I want to relearn many things. There are many things that I forgot. I missed them. I want to enjoy them again in my life. So this is a way how you can present yourself. If you have that part of like a lot of experience, use it to your advantage. If you have less experience, also you can use it to your advantage. But you have to search your school again here. It really matters, like to know what the school is looking for. Like if you are in Western, I would say, well, be a little bit of more of a shiny, young kind of personality side. Like be a little bit more positive, even sometimes too positive, too childish, I would say, in some parts. But still, even in Western, like the demographic, the age demographic is like from my age till like 40. But in Saskatchewan, be more professional because they want dentists who will talk with patients right away in the first semester that they go to school. Know your school, know your advantages and disadvantages, and use all of them for your benefit. And it is totally possible. So just forget about those myths about ethnicity, age. Like if you are a master, you won't get into school. No, Dalhousie got all the masters. So they say like if you are a specialist, you don't have much chances. Dalhousie is all specialists now. So these are myths. You have chances in Canadian schools, and I would say I would suggest this route over the NDEB path because at the end of the day, the possibility of you getting accepted in one of these schools is higher than possibility of passing the NDEC exam. So just go for your chance, and you will get it for sure. Just be prepared for the interview. Oh, no problem. I hope I could have explained everything in the right manner that everybody has a clear image. Oh, yeah, like it's different every time, I know. Sure. Yeah. Well, we came here as skilled workers. Back at days, like there were no express entry, like almost it was 14 years ago, 15 years ago when we applied. So dentists and doctors were under the category of a skilled worker at that time. So we came here as skilled workers, and nowadays they call it like most of this category is now for express entry, and there are still some skilled workers. Um, but two other routes that I know of for dentists to come here. One of them is to come here from with a student visa. Actually, my partner came here with a student visa. As dentists, we can apply to programs which are related to healthcare in any way. There are schools which offer actually a research in dentistry masters. UBC has it. I think McGill has it. Alberta has it. Specifically like dental research and dentistry program, master programs, which you can apply to. Also, you can apply to any public health program, any epidemiology program, whatever that you can relate to healthcare. And applying to master or PhD program, you can get a student visa if you get a seat. And after that, coming to Canada, if you finish that 2 years of master's or 4 years of PhD, your score in express entry will be way higher. At the end of the day, you have to go through the express entry pathway, but at least you are in Canada, your chances are higher, and you have built that score for express entry here. So applying to school is one of the paths that you can take. Unfortunately, for dentists and medical practitioners, doctors also, we have this problem that they ask you to self fund yourself. Like they don't give you funding that much. Especially for masters, they are not willing to give their fundings to dentists. They rather like they say primary care or something like their funding goes towards some other directions, not us. But if you can fund yourself, usually like the master programs are not very expensive compared to dental programs or specialty programs. Like they are somewhere around 5,000 to 8,000. Like the most expensive ones are around 8,000 per semester. So if you can fund yourself, apply for these programs. If you apply for PhD, you have higher chances of getting the funding. But PhD programs are 4 or 5 years, and you have to be really committed to go through that to get that score for express entry. But still, it's a good path, and schools are willing to accept the students, international students, especially that they ask you to fund yourself. Uh, why not? They like the students who go there, do the research, and even pay them. So they will accept you, and you can get the visa through that path. Also, there is one more path that I know, especially in the last 2 years, it's so famous. Everybody are taking is that for Iranians there is this policy that with any visa, tourist visa, if you're a refugee, whatever status that you have in Canada, you can convert to an open work permit. So if you're here with a tourist visa, if you can get a tourist visa, if you have a good travel history, and you can apply for a tourist visa. Just come here, turn it to an open work permit. When you turn it to the open work permit, then you can do the NDB exams. You can become a licensed dentist, even if you have. Like, it's usually for 3 years, and exams will take more than 3 years. But If you can do it in less than 3 years and you can become a licensed dentist here, you can even work with the open work permit. Many people think, no, you can't get the license unless you are a citizen of Canada or a permanent resident. This is also wrong. If you are on an open work permit in Canada, you can work as a dentist if you are licensed. So you can get an open work permit, come here, become a dentist, do the licensing process, or if you're so certain about getting the permanent residence card or the citizenship as soon as possible, you can get some other jobs and not general job, like not driving the Uber or working in retail, because these jobs don't have much score for express entry again. But if you work as a dental assistant, which as dentists you actually can go through two examinations here and become dental registered dental assistants. If you work as a dental hygienist, dental assistant, attend any college here on the open work permit and start working, again, your score will go high, like a lot above the average score that they take out of the pool for express entry, and you can apply to express entry sooner and have a better result, a guaranteed result of getting the PR here. These are two paths that many Iranians are taking because of this policy. Um, but at the end of the day, there are some provincial offers for the PR as well, that you become committed to work, for example, 3 years in the province of Saskatchewan, and at the end of the day, they will give you the permanent resident card. But these are like different programs. Each year they are different. Each year the number of people and applicants are different for those programs. I don't have all the information and details on those programs. But these two are the ones that I have seen most of my friends actually come here with that student visa and open work permit. No problem.
Thank you so much for explaining. That would be interesting for a lot of our listeners to know what are their possibilities out there, I guess. Thank you so much, Nagar, again. It was an amazing episode. I learned so much, and I'm sure it will be interesting to our listeners too. And I'm sure they're going to have a lot of questions. So, where can people find out more about you, or if they want to keep in touch with you, how can they do that?
I hope that I could have give most of the information that I have in this episode, but still, like, if you have any questions, I'll be glad if I can help. So you can reach me through my email. I don't know if you guys can provide it on the link. And also, my Instagram page is available, Nagar Madihi. If you follow me and like DM me on Instagram, I'll be responsive there because I check it daily. Like I scroll all the time now that it's my free time. But if there is any information that I can give, if I can be of any help in this process for any person in Canada who wants to become a licensed dentist, I'll be thrilled to be able to help. So make sure if you have questions, just reach to me through email and Instagram. I'll be there.
Thank you, Negar. It was really good. It was one of my favorite episodes.
All right. As always, thank you for tuning in. Make sure to subscribe to our YouTube channel if you're watching this episode, or leave us a rating on your favorite podcast platform if you're listening to this episode. And we'll see you in the next one.